Hi friends, I am Dr. Karthik from Chennai Plastic Surgery. A lot of false information in the media about a famous actress death recently. We thought it's our duty to explain about the liposuction and possible liposuction related complications. And first of all, liposuction is not a weight losing procedure. If you see the media, lot of times the media says the actress went for the weight losing procedure. Definitely not. And it's basically a body contouring surgery. Basically, if you lose weight but you are not losing weight in a particular area of the body because of your diet and exercise, that's called a resistant fat. There only that liposuction will work. Second thing, the media says that the death happened after a month after surgery, but it's very unlikely because the cause for the death, what the media commonly says, is fat embolism. I want to discuss about the fat embolism here because the fat embolism happen usually immediately after surgery, not after a month. So if you see what is fat embolism, the blood vessels open up and fat goes inside the blood vessels, goes through the lung and arrests the blood vessels supplying the lung, so that part of the lungs go for a death, so that lung can't cope up with the body mechanism. So the goes for the lung failure. So it usually seen in major bone fractures following the crush injury of the legs and the thighs. So what happens in the crush injury of the legs and thighs? The major blood vessels are opened up, and the nearby major big fat cells enter into the blood vessel, goes to the lung vasculature and arrests the lung blood supply. But in liposuction, earlier days, our doctors used the sharper cannulas. That time, few incidents of fat embolisms are noted. But probably last couple of years, all the doctors use the blunt cannulas. The blunt cannulas won't injure a major blood vessels. It only can injure a minor fine blood vessels, and it won't carry a big fat cells inside the tiny blood vessels. So what happens is, in the liposuction, fat embolisms are very rare because of we use the blunt cannulas. Even though it happens, it should be very milder form of fat embolisms, which usually managed by just supporting measures. So in our series of more than 2,500 to 3,000 cases, we have seen the fat embolism in two cases. One case, we observed him overnight by giving a oxygen supplement and discharged him next day morning. In the other case, we know there is a fat embolism. Usually, since we do a lot of volume, we have few signs to understand the fat embolism happened during the surgery time. So the fat embolism happened for the second case. We know there is a fat embolism happened, so we haven't discharged in the same day evening, which normally we do for a normal liposuction cases. So we discharge him next day morning. These two things are the only cases of fat embolism we have seen in our clinical practice. So consider, like, in 3,000 cases, only 2 cases we have noted fat embolism. Then think about the incidence.
Hi friends, greetings from Chennai Plastic Surgery. So in continuing with the discussion that Dr. Karthik had regarding the death of an actress following liposuction, we have to understand that during liposuction, the fat containing cells are manually removed out from a particular part of the body. Fat deposition varies from person to person and between gender. Generally in men, fat gets deposited in the tummy, the sides of the tummy, back, and then the chest, upper back. In women, it gets accumulated either in the front of the tummy or in the thighs or in the arms, etc. When fat is removed from a particular place, the fat cells are manually removed. So if you're going to gain weight, the fat has to go and get deposited somewhere else. When it comes to the tummy, we have to understand that fat gets deposited either underneath the skin or in the place in between the intestines. So for example, if a woman says that I have had liposuction done for the tummy, but my tummy is starting to show out again, she might actually have fat getting accumulated intra-abdominally. That is in between her stomach and the intestines, which is behind the muscles. So that is not a place where we can do a liposuction again. So if that is happening, the only way to get rid of that fat is to hit the gym or do some diet and reduce it yourself. So when a plastic surgeon or a cosmetic surgeon examines you and tells you that you do not have a subcutaneous fat or fat underneath the skin that can be removed by liposuction, he should not be pushed. Most of the doctors desire to get a good result of the surgery, just like what you feel. So when a doctor says that you are not an ideal candidate for a particular procedure, do not push him or try to find another person to get it done. So you might end up in trouble.
So hope you understand about the fat embolism, how it is very uncommon in liposuctions, and how even if it happens, how it will be very milder in fat embolism in liposuction cases. Obviously now you have a clear idea. So I thought it's our duty to explain about the fat embolism so that our clients should not get confused about the fat embolism in liposuction. Thank you so much.